Hello, I'm Dalton House.
I'm Madeline Wilbanks, and on today's segment of Anatomy stresses me out so bad that I want to cry, we're going to be talking about joints. Every bone in the body forms a joint with at least one other bone. The two functions of joints are they hold bones together and they allow mobility. There's a wide variation of movement from the way football players have contact with other football players on the football field, and ballerinas are graceful and they dance. There are two classifications, structurally and functionally. The functional classification focuses on the amount of allowed movement. Synarthrosis is immovable. Amphiarthrosis allows slightly movable movements. And diarthrosis is freely movable. Structurally, there are fibrous, cartilaginous, and synovial joints based on which of the three separates the bony regions at the joint.
Synovial joints, the articulating bone ends, are separated by a joint cavity containing synovial fluid. They account for all joints in the limbs. All synovial joints have four distinguishing features: articular cartilage, fibrous articular. My paper's in the way. One moment, guys. The wind is pretty nasty today. Articular capsule and fibrous connective tissue, and the capsule is lined with a smooth synovial membrane, hence the name synovial. Joint cavity, the articular capsule that the joint cavity contains lubricating synovial fluid, reinforcing ligaments. The fibrous capsule is usually reinforced with ligaments. They are common where ligaments, muscles, skin, tendons, or bones rub together.
Cartilaginous joints, the bone ends are connected by cartilage. Examples of this kind of joint, which are slightly movable, is the pubic symphysis of the pelvic and the intervertebral joints of the spinal column, where the articulating bone surfaces are connected by pads of fibrocartilage. The hyaline cartilage epiphyseal plates of growing long bones and the cartilaginous joints between the first ribs and the sternum are immovable.
Some diseases like water on the knee, a painful bursitis caused by falling due to inflammation of bursae or synovial membrane. Sprains and dislocations. In a sprain, the ligaments or tendons reinforcing a joint are damaged by excessive stretching, or they are torn away from the bone.
Fibrous joints are bones that are untainted by fibrous tissue. Best examples are the sutures of the skull. Irregular edges of bones interlock and are bound together by connective tissue fibers, allowing essentially no movement.
A closer look. Although bones have a remarkable self-regenerative powers, some conditions are just too severe for bones to repair. Examples include extensive shattering, poor circulation in old bones, and certain birth defects. Electrical stimulation of a fracture sites dramatically increases the speed and completeness of healing and slowly healing fractures. The most common troublesome injuries to a bone are non-union fractures.
Fractures, in which the two parts of a split bone fail to join.
A potential improvement is the free vascular fibular graft technique, which uses pieces of the fibula to replace missing bones.
Types based on shape. The bone surfaces determine what movements are allowed at a joint. Based on shape, synovial joints can be classified as plane, hinge, pivot, conoid, saddle, ball and socket joints. Plane joint surfaces are essentially flat and only short slipping or gliding movements are allowed. Hinge joints, cylindrical, and one bone fits into a trough-shaped surface on another bone. Pivot joints are the rounded ends of the bone that fits into a sleeve or ring of a bone. Conoid is an egg-shaped articulated surface of one bone that fits into an oval in another. Ball and socket. The spherical head of one bone fits into a round socket in another.